Sure, I'm happy to share that at ASH this year we'll be having an oral presentation on our experience with the use of outpatient and various tools, including remote monitoring and home health visits for our patients who receive both CAR-T and bispecific antibody. We have presented on our outpatient model in the past that really includes a revolving door system between an outpatient unit and inpatient with a continuity of care for the team of nurses, APPs, and physicians that really take care of the patient through the CAR-T acute monitoring phase and for the bispecific step-up dosing phase. What we have incorporated this year is really, since we have ways of having a continuous monitoring system when they are at home, we've incorporated the use of Tocilizumab for initial management of CRS on the outpatient side for patients receiving CAR-T and only admitting them if they do not respond. And so far, we've treated 18 patients in this manner, and 17 of the 18 patients, so 95%, are able to stay outpatient. They do not need to be admitted for the continued management of the CRS, and those patients continue to do well. Less than half of those patients needed subsequent hospitalizations for other issues during the months post-CAR-T. So that's very encouraging for further extending our capability to manage these patients out of the hospital. In addition, for the second half of the month, post-CAR-T, it's really a lot of recovery periods for our patients. Any recurrence of cytokine release syndrome or neurotoxicity are quite low during this period. So we really looked at monitoring these patients with more home health visits that would connect with our outpatient team for overall management and only bring those patients into the clinic if they need specific intervention that we feel should still be given in the clinic. And we found that overall this has been very feasible to do and significantly reduce the number of visits on our clinic. And in a poster presentation that we also have about our outpatient experience, we show that the patient response survey showed that even though they're not coming into the clinic and seeing their team, overall they're reporting very high satisfaction with this system, feeling that they are well connected to the team and that they are well managed, even though they're not coming in as often in general to our clinic and hospital system.